Hi, this is Mary Rubino, and the show is Naturally Speaking. And last week we had Michelle Cordani, and Michelle's a wellness coach, and she was talking to us about a whole body approach to being a wellness coach. Today we have Leslie Barnett, and Leslie has a little bit of a different spin, even though she is also a wellness coach. Leslie's focus actually is a lot on Lyme disease, and so I welcome you here today to kind of expand on that and let us know, that's a big issue in this area, so if you can explain how you work with people and how you came into that.
Sure, yeah, I think that's most important is talking about how I got into it. I actually had a lot of health issues, and I would say even though they started in my teens, they really came to the forefront when I was in my mid-40s. And that's when I was struggling with depression, and I went to my doctor and said I'm feeling a little bit low. It wasn't severe depression, but it was. I was able to recognize I was having an issue. I was a mother of 2 young children, and I didn't feel like I was mothering the way that I wanted to. So I walked into my primary care physician's office and said, I'm feeling a little bit down, and I see these commercials on TV for Zoloft and Lexapro, and my sister said maybe they'd help. So she literally pulled out her prescription pad and wrote me the prescription and said, here's your prescription for your antidepressant, go home and take it, but maybe check in and see a psychopharmacologist because you're taking something for your brain. So I thought that was really strange to begin with. There wasn't one question about what kind of stressors there were in my life. What was my diet? Maybe let's do a little blood work. Let's see what's going on in you. Instead, it was the prescription pad in here and send you on your way. So fortunately, I did go see the psychopharmacologist, and as I'm sitting there, I'm taking the medication. Not only is she telling me to take even more medication, I was sitting in those meetings and going, I really shouldn't be here. This is just not right. I am not a sick person. What's going on? And she's asking me about all my issues. And in the meantime, I'm thinking, is this medication affecting my brain? Is it not? So I was able to be disassociated with that process I was going through, which was kind of interesting. At that point, I really said, I knew it was a Band-Aid, and I started digging into really what was going on with my body, and started researching on the internet every single night, probably till 12 and 1 in the morning, to figure out what was going on in my body. And this is where I learned that the foods we were eating could be affecting our brain and our energy levels, with food allergies. If we weren't digesting our foods properly, that was going to affect it. And if there were functional medicine tests that could be done. So I started to look for doctors in the area and had a really difficult time finding doctors who would even provide this kind of testing. Fortunately, I found somebody in Watertown, New York, she's no longer practicing, that agreed to see me. She talked to me about food allergies. This was all on the radar to me, new on my radar. And when I said, do you mean the foods I'm eating can actually make me feel depressed? She looked at me like I had 2 heads.
Right.
Like, of course. And she was trained in Germany, so she had a European approach where this type of information was known. So that started my journey in the holistic health approach. And when I was teaching myself all this information out, how to change my diet, what supplements to take, I swore to myself that I would share this information with other people, so people didn't have to go through this, could get them off the antidepressants. And this is a little bit long story about how I'm going to get to where I got to with Lyme disease. I then, once I was really feeling better, had gotten off the antidepressants, which that in and of itself was a very difficult thing to do. So I'm very aware of how challenging it is for people to go off the antidepressants. I went to the Institute for Integrative Nutrition to learn about this whole holistic approach that your guest that you had on last week learned about. So we're looking at not just the foods that we're eating, but this total picture about spirituality, friendships, your career as the primary foods that are feeding us.
I have a question for you. So you were feeling depressed. When you changed your eating patterns, did your mood start to lift?
Yes, absolutely. Okay. I was able to go off the antidepressants, and it really resolved the mood issues and my energy issues as well. Yeah. It was amazing.
So that's a really important thing for people to know, because they may not, unless it's like a circumstance or maybe it does have something to do with what you're eating and what you're fueling your body with.
It has a lot to do with the health of the gut and how you're digesting the food as well. So if we're not breaking down those foods, those large particles actually act as invaders in our body, and your body actually has an inflammatory response to looking at those food particles where they would be normally just food, but since our gut is compromised,
And we're
it's
talking
not
about
great.
processed food, though.
Processed
Yeah,
food, but
so,
also
yeah.
even you can get allergies to many other foods if our gut integrity is compromised, and that means leaky gut. So you could actually even have an allergy to something that's a very healthy food.
Yeah.
I've heard of people being very allergic to lettuce. And then you get this thing called cross-reactivity towards foods. So if you eat a food that you're really reactive to, which may be wheat and dairy, eggs, soy, peanuts, those are the top reactive allergic foods. And if you eat another food with that, there's something called cross-reactivity. So then your body can actually attach an allergic reaction to that healthy food as well when you eat it in conjunction with that allergic food. So just know cross-reactivity
So
is a
you're
big
very
one.
fortunate to have your depression being created from the food and find out about that.
Absolutely.
Now, I want to make sure I mention that obviously not every depression is fueled because of food or anything like that. We're not trying to say that, but we're looking at the possibilities of it not just being regular like mood disorder.
Right.
That we want to make sure that people understand that you want to get a whole body approach to this. You want to find out more before you do any kind of treatment.
Absolutely, yeah. Work with your doctors. Although, just find the right doctor that maybe has a more alternative approach, because I actually talked to the psychopharmacologist about this information I was learning, and she, for lack of a better word, poo-pooed it, and just said, forget that information, there's no scientific research backing it, which is not true. She just wasn't aware of it. And she said, eat every food you want and take your medication. So it was a very classic approach, which I understood, and then I decided to move on from there. And
so you questioned it,
I questioned it and just decided to take my health into my own hands, which is something that I promote with people, other individuals.
Well, you definitely want to be able to question things, because the idea that you have to take a chemical to feel better on its own is something that's worth questioning.
Yes. So 2008, I got my certification in holistic health counseling from the Institute for Integrative Nutrition. Was really excited about starting my practice, but started not feeling well, and I couldn't figure it out. And it started probably, I graduated in June, the symptoms came on towards October. I was getting paralysis, severe joint pain, severe depression, severe headaches. I just couldn't move. I felt like I was 90 years old, sweating at night. And at that same time, I was in my early 50s, and I really thought it was menopause. So I went to doctors. But I do want to mention that in the summer, this is leading up to my history with Lyme disease.
Exactly.
Okay. So in the summer, I had some sort of insect bite. It was on the inside of my thigh. I went to my primary care and asked her, could this be a tick bite? Could it be Lyme disease? She said, absolutely not. It's not a bullseye. I saw another doctor in that same office. No, it's not a bullseye. It's not Lyme disease. I went to a skin specialist. All three of them said, no, there's no way it's Lyme disease. You don't have to worry. It's just an insect bite. But lo and behold, about 4 months later, I started coming down with very significant neurologic symptoms. And the first one was tingling and numbness in this arm. So as I was driving the car, maybe talking on the cell phone, which I shouldn't be, I would have to put it down and shake my hand out, and that wouldn't help. So it wasn't as if it was a neurologic blockage, something was going on in this area.
It wasn't like it fell asleep, right?
It was like it fell asleep. I couldn't dry my hair. And I thought, well, maybe there's just something electrical going on. And then the symptoms started spreading all over. I got severe weakness, had trouble getting in and out of my car. My hips weren't working. And as I said, the sweating, the depression and fatigue, and my memory went. My short-term memory completely went.
Wow.
And fortunately, I was looking for a new primary care physician. She was at the Merino Center, and she was Lyme literate. But it just so happened that I had to diagnose
What's it mean?
myself
What's Lyme literate mean? Yeah.
So that means she's familiar with some of these idiosyncratic symptoms of Lyme disease.
Okay, so she was familiar with what Lyme disease can
looks
cause,
like,
yeah.
what it looks like, and also familiar with treatment.
And it doesn't have to be a bullseye bite, by the way.
No.
We already knew that's
Right.
not true.
Right.
Right.
So I was affiliated with a wellness clinic in Natick, and this wellness clinic would bring in practitioners occasionally on the weekends. So I went to this weekend practitioner meeting, and they had a representative from IGeneX, which is the top Lyme testing lab in the country. It's located in California. And this is the man, his name is Bob Giguère, and he gave a presentation on all the symptoms leading up to Lyme, what chronic Lyme is. And as I'm listening to this presentation, it's registering in my mind, oh my gosh, I've got Lyme disease. And I couldn't get out of there fast enough and get on the phone to my doctor to please get me in as soon as possible because I need to be tested for Lyme disease. So it was actually a process. If I hadn't seen that, well, fortunately, I did have this next appointment with my new doctor who was going to be Lyme literate, and she probably would have picked it up. But still, I was able to move that appointment up by about 3 or 4 weeks, which was really good. So my symptoms it wasn't able to go that much further into my system as well.
So now when someone has Lyme disease, how treatable is that? Because I really don't know much about that at all.
So if you are able to get a diagnosis very early based on clinical symptoms and perhaps a rash, it's very treatable. But it's important that people know that she'd be treated for at least 6 weeks with an antibiotic at that time. And typically if it is at that early stage and for that length of time, it really will address the infection, and you should be really fine.
Okay.
But that's absolutely critical, getting it early. So
early?
That would be within maybe a month of the bite, a month of because the bullseye may show up within a week, and then often it's 3 to 4 weeks, 5 weeks even before that bullseye will start to dissipate. By then it's gone systemic. So making sure if you have a rash, getting it looked at, trying to get to a doctor or practitioner that is Lyme literate, that knows it doesn't have to be a bullseye,
right?
And that's willing to be able to prescribe antibiotics for that 4 to 6 weeks. If you're an alternative holistic health person, you can also go on to strong antimicrobial herbals, which could be very effective as well. So I'm not saying antibiotics are the only route, but getting on very strong antimicrobial herbals is another option for people who don't want to do antibiotics.
What happens if it's too late? What if it's like diagnosed like a year after or something like that?
So that makes the situation much more challenging to address in terms of healing. And you have to know that the Lyme bacteria does love tissue that is outside of the bloodstream. So it loves soft cartilage. So that's why a lot of people who have chronic Lyme, and I would define chronic Lyme as a Lyme case that had not been treated, say, within the first 6 weeks, then I really would look at the Lyme infection as a chronic infection, because by then it's gone into tissues that are not just in your bloodstream. It's actually been able to drill into tissues throughout your body.
That's scary.
It's very scary, and people have to recognize that antibiotics typically work most effectively within the bloodstream.
Right.
And they aren't often able to penetrate that soft cartilage, joint tissue, fascia, and that's often where the Lyme disease is able to penetrate. So just knowing that is important to know that you could be looking at a longer course of antibiotics. Some people are on antibiotics for 3 months, 6 months, longer. But there also, I really want to emphasize this, that there are natural approaches that can be just as effective. God bless you.
Thank you.
Yeah.
So in your practice, which is very focused on the Lyme disease for people, do you usually just see people that have Lyme disease, or is it more, do you see other people that don't have Lyme disease? Or?
No, because I started out with nutrition counseling, I see people with just digestive disorders and fatigue issues. There's yeast that goes on that's causing those symptoms of chronic fatigue, bloating, constipation, fatigue, migraines, headaches, focus issues. So all those often are related. But often, I think there's often an infection component to it. So it could actually, and I try not to say, look always for Lyme disease in the people that come to see me, but it's hard not to. But it does affect so many symptoms. It can replicate, you know, other illnesses, disease that, you know.
So it could be missed, that you could be diagnosed with one thing, but the core issue could be Lyme disease.
It could be
or
Lyme
the other way
disease,
around.
or the other way, absolutely. And so testing is really important in terms of ruling some of those things out. So I think that that's important as well.
So what's with the testing for Lyme disease? Because I have heard that you can be tested and you could have a false positive or you can have a false negative. What's the best way to get tested for that, to be sure?
There are a couple of different ways that you can get tested for it. One is to go through, the gold standard typically is iGeneX, a company located out in Palo Alto, California, that is actually able to pick up antibody response to the Lyme bacteria. And it looks at, they call these bands of antibodies. So there may be probably 15 different bands that are known to respond to the spirochete, an infection with Lyme. And it's the Lyme bacteria is a spirochete, which means it's spiral shaped and it can drill into tissue. But they also, so if you have, your body raises an immune response, it will create antibodies towards that particular infection. And these bands or antibodies that this company measures are associated with spirochetal infections that are often associated with Lyme disease.
Oh, I see. Okay. So it's more specific.
It's very specific. And so if there's discrepancy between what the company iGeneX says is a positive test result and the CDC, which is the government agency that says that you have a positive test result. It's very important, people, to know that the CDC test results for qualifying for a positive is strictly for surveillance purposes to determine whether a case is reportable to the government or not. But many doctors see that CDC qualifications for a positive result as a diagnostic tool, and that's where so many doctors are confused and why people are walking out with negative test results, even though they may have 3 to 4 bands that are positive, because in some, whether it's IgM or IgG bands, you need 5 on one particular one to qualify for a reportable case of Lyme disease.
And that would be only reportable to the CDC.
Reportable.
Yeah,
but
Center for Disease Control, right?
Right, but but you may actually have Lyme disease. But doctors may think that it's a diagnostic tool, but that's really important for people to know if they're going in and looking at their test results. If they have a few bands, they really most likely do. In Germany, you need 1 band of the specific.
Wow.
1.
What a difference, huh?
What a difference.
Yeah. So this gave you quite a big education when this happened to you. And it just so happened you already had the background in this nutritional counseling. So that's very, very powerful the way that happened
I think
to you.
the nutritional counseling really helped me in getting better. Now, it was a very long haul to get better because of the lack of good practitioners out there to know how to treat Lyme disease. It's a tragedy.
Is it getting better with that? Do people start to understand a little bit better?
A little bit better. More and more doctors are recognizing it. They're testing for it. They're more willing to give longer courses of antibiotics. But it's a confusing illness for so many doctors that many of them want to wash their hands of it. They don't want to go near the illness because it's so confusing. It's so multi-systemic, and then also not only is the disease associated with just one bacterium, but you could get other bacteria that are parasitic infections. Ticks carry parasites such as Babesia. There's an intracellular infection called Bartonella. Then also, because we are carrying so many different bacteria in our systems that are called opportunistic, because our immune system gets shut down, we could get C. pneumonia, which is a chronic kind of pneumonia, a mycoplasma infection. So because we get weakened by that, all these other infections can kind of take hold of our body and present in so many different ways.
So you can see where it would be very, very confusing.
Parkinson's, multiple sclerosis.
All those things,
All those things. Neurologic system, heart, it goes into your heart, lungs.
So it could affect all different parts of you, and then it would be very hard for them to be able to be positive that what started that in the beginning.
And so many doctors feel that they create cocktail approaches with antibiotics, so it's antimicrobial, antimalarials, antibiotics, antiparasitics, then you got antifungals.
Holy cow.
And most doctors really aren't educated that well in creating that kind of protocol for treating an illness.
Intense.
It's very, very complex when you look at the illness not only from a person's individual, how they're presenting it, how their body is responding to it, but then how to treat it too. Oh gosh.
My God, you must have been scared out of your mind, and then trying to, as you started to learn more, then feeling like you're more at risk for everything.
Right, right. And that's where in my work with clients, it's educating. There's an awful lot of educating about the complexity of the illness, but also giving them tools as to things that they can do to help themselves get better. And that's so important. I think it's what helped me get better. And educating yourself about all the tools that are out there and available that may be not offered through practitioners, because you do kind of have to really take the bull by the horns.
So what kind of things would you do if someone came to you and they had Lyme disease and they wanted to treat themselves in a certain, for that, what would you recommend?
So there are a lot of different ways. It does get complicated, but number one, I really look at the diet, and people have to eliminate sugar. Sugar feeds, most people know that it promotes cancer, feeds cancer, but also bacteria love to live on sugar and the fungus. Okay. So it's the dietary things, really moving over to a very clean, healthy diet, lots of fresh, organic, whole foods, as much raw as possible, juicing, really giving ourselves the nutrients they need to begin to fight it off, okay? Then some supplementations, but I think the detoxification pathways are really important in healing from Lyme. When you get Lyme or any chronic illness, the energy in our cells gets depleted. And once that energy gets depleted, our bodies just can't fight and function the way they need to.
Right, they can't fight anything off.
So it's stimulating that and opening up, doing things. There are supplements you can take to open up the detoxification pathways and lymphatic drainage. So it may be doing lymphatic massage to help detoxify. So once you get these detoxification and lymphatic systems open, then maybe you can start to go in with killing, quote unquote, killing programs to actually address the the infection.
Wow.
Yeah, because what happens if you go in right away and start killing these infections, there's something called a Herxheimer reaction, a die-off reaction. And these are called endotoxins, and they can actually make you feel much sicker than you already are. So this Herxheimer reaction, you can even get something called blood sepsis, which is a poisoning of your blood system with too much die-off, too much toxins that are being released from the disease. It's very important for people to be aware of. So you actually want to go, it's almost like a dance, and you want to go 2 steps forward, 1 step back, and it's this constant dance on the healing process. So it's not something where people go in and you take your med, you're going to feel better within a week, and you go on with your life. It's this dance that you have to create with the illness to build your body up, to attack it, and this constant build, tack to get better. Attack, yeah.
So when you see people, you help them work through all that?
Yes, that's what I try to do. So there's some antimicrobials. I want people to know that they can really, they're very, very sick, and it's acute, there's this kind of acute chronic stage where there's a lot of infection still in the blood and in the tissue. And in that, I really work with people to decide whether they want to go with antibiotics, and there are doctors I can recommend, or they want to go with a very well-trained herbalist, which I recommend if they want to go the natural route. So I do think professional guidance with people who really know herbs and antibiotics is important.
Yeah.
I'm not going to do that. If somebody has this case where I've been on herbals, I've been on I'm pretty good, but I'm kind of like working on that last 20%, I can really help people there with fine-tuning their approaches and really encouraging them to take it on themselves with maybe some guidance from an herbalist if they want to. But in that initial phase, that really acute chronic, it's almost an acute chronic, I really recommend they go to see somebody. And then I can help with the supportive area, which is the diet, and then lymphatic, and make recommendations with sauna, the detoxification types of things, supplementation. That
Now,
type
do
of-
you work at all with Janet Mathis? I know she's at in your office as well.
Yes. So Janet is great because she can do some massage therapy with opening up the lymphatic tissues.
Yeah, I was wondering about that. The moment
very
you
gentle.
said that, the lymphatic massage, that made me think of that. Yeah.
Yeah.
So that's quite a.
It's a mouth.
quite
It's a
a-
head
yeah,
full. It's a head full.
Well, it's good that you understand it enough to be able to guide people through the process, and it's really important for people watching the show to understand that they need to have very comprehensive testing and find people that understand
Yeah.
how to heal from this. Because it is in this area, it's much larger because there's so much forest, and there's we all like to go. People like to go hiking, and trying to be cautious and
It's a real
being
epidemic
careful.
around here, and I don't think people are getting really the help that they need to get, through the conventional medicine approaches.
Well, especially if someone doesn't, if they're not diagnosed properly.
Right.
If they're getting the testing done, and 3 bands show up, and it needs to
Yeah.
be 5, and so they're kind of like, oh no, that's not the actual.
They will. Doctors will actually say you do not have Lyme disease. You have something else, and that's very discouraging for somebody to hear, because then they're taking medications for this. I've worked with people who. One young woman I just recently was in touch with. She's 21 years old. She's been misdiagnosed for 3 years with chronic fatigue syndrome and fibromyalgia. She's probably been on 15 different, whether it's medications for steroids, rheumatoid arthritis. It's so sad, and she is still struggling. But right now, we've gotten her in touch with a very reputable doctor that works in New York, in touch with 2 or 3 herbalists. She's in that process of deciding how she wants to address the illness going forward. But this is so classic and typical for people to go with top specialists in the even in the country, in the state, with their particular symptoms, and them it not being recognized as this other issue, which is infection based. So that we're all siloed. Most of the medical profession is siloed, and they're taught they have their specialty. So it's that Chinese elephant story. If you're looking at the elephant's leg, it feels like a tree trunk. If you're looking at the ears, it feels like something thin and flappy. So many of these doctors are very well trained and very well educated in their area, and I
but
really
that's
respect
not
them.
their area.
But they may not be taking that extra step. Is this infection based? And that's the infectious disease, the ID doctors who need to look at that. So there needs to be a lot more cohesion, communication among the disciplines. I think among doctors to really start exploring this more. Yeah,
Okay.
it's eye opening.
So is there doctors in this area that are well versed in it, or are we talking people have to get in touch with doctors in New York, though?
There are doctors in the area. Sadly, many of them you have to pay out of pocket to see them, and they're very expensive. But those are the ones who take very comprehensive approaches and really understand Lyme.
As a physician,
disease.
they don't cover insurance. They're not covered by
Some
insurance.
of it might be covered by insurance. But more and more doctors are becoming Lyme literate. They will give extended course of maybe 1 or 2 antibiotics. And so that's happening more and more, but it's not widespread yet, which
Yeah.
hopefully it will be sooner than later.
So now you do presentations on this to help people understand it.
Yes,
That's
yeah,
good. That's
love to do.
important because I've only touched on it a little bit. I've only heard about it a little bit.
Oh,
I've actually
wow.
been tested myself, and it hasn't been.
No,
Yeah.
so the classic tests that most conventional doctors will do are not through IGNX, because that's an out-of-pocket test that people have to pay for
Right.
themselves. It runs around $200 to $300. It's what I paid. I remember when I first was with this doctor, the Lyme literate doctor, and she suspected I had Lyme disease. I had to pay close to $900 out of my pocket to get the accurate testing, because it's not covered
Wow.
by insurance, which is really sad. And
That
the
is
tests,
very sad.
The tests that are covered by insurance are getting a little bit more accurate, but you have to know that they are not that accurate. They're based on antibody response. it may be your body may not be because the Lyme disease can actually suppress your immune system.
Right, exactly.
You may not be getting the antibody response that needs to be at the level to be picked up by that test.
Oh, okay.
Okay, so sometimes you have to even do a forced antibody test, which is get on antibiotics that gets your immune system going, then go in for a test and it will come out positive.
So in other words, it can create an immune suppressed body, so it can create a suppression so that the infection doesn't show up as live as it really is, right?
Exactly.
So I'm a little bit familiar with that because I take immune suppressant drugs. So if I were to be sick, my temperature would only go at the most maybe 100, but I'd be very ill at that moment, whereas someone else may not.
Exactly.
So my body doesn't react the same way.
Yeah.
So what you're saying is that if someone has Lyme disease, their body may not be creating antibodies because it's actually not able to.
Exactly. And so those are the tests that the doctors are dependent on, and that's where you get the false negatives.
Yeah, because it won't show up.
It won't show up. And then they have the test that IGeneX does through the conventional testing labs, but they've removed a lot of the bands that are actually specific to Lyme disease, which is crazy. So you're not going to be able to get those CDC bands that they're actually even looking for. It's just a convoluted system that people really need to be aware of. They really need to be aware of the disadvantages of this type of testing, the inadequacy of it, the inadequacy of this type of testing that people are putting their lives on, yeah.
So what kind of symptoms, if someone thought they may have Lyme disease, what kind of symptoms could they expect to have?
So, starting in the head, you could get the brain fog, so confusion, ADD type of symptoms. You can get massive headaches and memory issues. So that would be in the head. Moving down, you can get any kind of joint pain, so it can be either in a large joint or in small joints. I had it all in my hand and arm here, and my hand was actually seizing up and becoming paralyzed. So there could be paralysis. There can be numbness and tingling anywhere in your body. With one of the co-infections, the numbness and tingling can often be on the shin, so it may present as a type of shin splints, but it's very different from shin splints. People often refer it to as a burning sensation.
Okay.
That can be one. The bottoms of your feet can be very painful in Lyme disease and co-infections, and I'm going to call this Lyme disease and co-infections because these are all associated with tick bites. Okay, so typically these co-infections could actually supersede the Lyme symptoms, the co-infection symptoms, okay? And I'm talking, my daughter had Lyme disease in 2013 as well. And it's important for people to be aware of this. I was very, very familiar with all the symptoms of Lyme disease. And she was in college, and she started calling me with really strange symptoms throughout the fall semester of her sophomore year. And we threw it off to really bad sneakers because she was getting this burning sensation in her shins, panic attacks, anxiety, and we thought, well, she's under a lot of stress with
she's
her.
in college, right?
And focus. Okay, so those were her symptoms. During the winter break, I was able to get an appointment with the Lyme literate physician that treated me. And she looked at Kristen, heard those few symptoms, which were completely different from mine symptoms, and said, "You've got Lyme disease." And I looked at her, I said, "No, you're crazy. It's anxiety disorder. It's something else going on."
But it showed up differently.
And, a neurologic thing going on. It showed up completely differently. So those are even more, the anxiety. And she had even something called misophonia, which is where you hear somebody, just crazy, but this is how it can affect you neurologically. If somebody next to you is eating a sandwich and chewing too loudly, the reaction is you want to punch that person in the face.
Oh my!
And you want to literally, it's an involuntary reaction that this sound, it bothers you. And when I had heard my daughter talking about it again, I was like, well, just move to a different seat. This is nothing, But coincidentally, the Today Show, the very next day, had an episode on misophonia and how this is actually a reaction people get towards.
That's crazy.
Isn't it?
I have heard people say that when they hear someone chewing and it seems loud, it bothers them.
It bothers them. And this woman was on there that she literally wanted to go up and strangle people when they were in a room
That's
and they
so
were hearing,
funny.
isn't it? So that I really think that that was a reaction, one of the crazy symptoms. So it really, that whether that is actually a specific one, but everyone's going to respond so differently. So I would
So it
say
would really
it's a
be kinda
different.
hard to-
It is, but it's something outside of your normal pattern of behavior. So I think insomnia is a huge one. Waking up at night I had electricity going through my body every night at 2 a.m. Boom, wake up and I couldn't go back to sleep, and severe pain in my arms. Drenching sweats is another one in the middle of
So
the
I
night.
can see where you might have thought
it's-
that could have been menopause or
Menopause,
something,
yeah,
right?
the drenching sweats is a very prominent one. So yeah, they can be confused with a lot of other things. And our system is so label oriented. We want to put a name on this set of symptoms. That's really what our medical system has been
Well,
boiled
that's what they're
down
used to, yes.
Putting names on labels. And I really think exactly what Michelle was talking about last week, where we've got to get to the root cause of things. Is it an infection? Is there neurologically, is it a gut dysbiosis thing? Well, what's causing that gut dysbiosis? Is there infection there? What's causing the memory
A
issue?
lot has to do with people being
Getting to
able
the cause.
listen to yourself.
Yeah.
Because if you have something happening in your body that is abnormal, it's out of the norm, you really do need to raise the flag. You really,
Yeah.
and if you go to a doctor and they're saying it's fine, and you know it's not, you need to listen to yourself.
Yeah, I really think this is a place where health coaches and wellness coaches are really going to start to play a bigger role in people's health, because they're not getting the response they need from the doctors. I lost faith in conventional medicine. I
would
don't
imagine
really
that would have
trust
been really
that.
hard for you.
Yeah. I know that there's a role, there's a very important place for them, absolutely, but in terms of these more insidious, chronic types of representations of illness, doctors have a tougher time. They're more likely to treat the symptoms as opposed to really try to get deeper. And I'm not saying across the board. There are so many good physicians out there, really, respect and take a lot of pride in their work. Just try to do your best to find a really good physician.
But there is a mentality where if the symptom's gone, you're better. Whether it's, and of course it isn't really true, but if the symptom's gone, you're better. And so doctors are in the habit of helping people relieve their symptoms. And there's a lot of different pieces to that. It could be they don't have the time, they don't have the wherewithal to even work with people for what the core issue is.
Yeah,
it may not be a
absolutely.
medical issue either. It could be something different.
And Mary, one of the things that I've really learned, I have gotten very involved in energy healing, pulsed, and I bought a machine called an OnDemand machine, which is a pulsed electromagnetic field therapy machine to actually help people with Lyme disease. Because what happens is our bodies get clogged up with...
You're talking about your energy, exactly.
This is
energy flow.
Energy flow,
Right,
yes,
exactly, in your body.
And this is with pulsed electromagnetic field therapy. It's able to emit very gentle pulsed fields that can open up pathways of energy healing within our bodies that are clogged, and those pathways can be clogged from past traumas, surgeries, infections.
Even memories can create that.
And memories, which you know so well.
yeah.
So this is really important for people to be aware of, get on their radar. So it's either doing the work that you do with EFT and hypnosis, it's finding people who do Reiki energy healing, there's myofascial release, there's acupuncture.
Meditation as well.
Meditation, all that's really important in the healing process too. And I've really, come to learn how important that aspect of the healing is. So it's
huge, yeah. And I mean, a lot of times we don't understand what we're carrying with us. That we don't have to.
The subconscious is very, very big, and I especially think that's a big role when people have trouble getting well. They need to go to the deeper levels. They can take all the medication supplements. If they're having trouble, there's another layer they haven't uncovered yet, and I think your type of work can really help them with that as well, from what I understand. And then essential oils and flower essences, another type of energy, homeopathy.
There's a lot of stuff out there that's just incredible how well it works. And even things that seem very simple, but they're powerful.
Very
people
powerful.
don't think about it.
I really
And
encourage people to open up their minds to these, to learn, to teach, to really. It's an opening of your mind to this type of healing.
And that's what we're trying to do here, is kind of raise that awareness so that there is no one size fits all. There is no, you know, if you do X, Y, Z, you're going to be good forever, because people are so individual. Their experiences have a deep influence over their lives, you know, and so it is.
And creating,
these
blockages, energetic blockages, yeah. I've had a really, it's been a valuable healing journey for me, and I'm so happy to be able to share what I've learned in that healing journey. But through it, I've done Chinese herbs and medicine, and I've done other types of biofeedback therapies, and all of it was, every single thing that I did was another step in that healing process.
Yeah, and you really don't know what will work, because everyone is very individual. You know, even in the physical world, as far as like workouts, and some people do very well with yoga, and other people do well with Tai Chi, and sometimes it's a combination of a bunch of different things. I always think that it's really powerful with hypnosis, because you know, you're working with your thought patterns and how to redirect your thoughts. But there's all kinds of things out there, and I think it's really important that you're raising awareness about it, you know, in a whole body way. Michelle was doing that, talking about that as well. And there's so many people out there that are really willing to help people move through these things in a whole, like I said, a whole body way. Yeah.
So I want to mention one other thing too that's kind of a new development. Going to be shifting over my business. My practice has been called Barnett Wellness Consulting, and that's worked really well, but I'm shifting it over to a new concept which is called My Healthy Habitat. And it really embraces the holistic approach to healing and wellness, and with Lyme disease. And
are you going to have a website that's called My Healthy Habitat?
My Healthy Habitat. Yeah, and looking forward to. And it's this embracing of the approach, not only of our internal environment, but it's our external environment as well.
Exactly, it's big, yeah.
And part of that is not only the toxins that we're putting in our bodies, but there are many toxins that are around us too. So whether it's EMF fields, or toxic relationships and toxic habits, all that is going to be incorporated.
Yeah, and I mean, when the focus goes on being in better environments, and then the focus goes towards that, it'll be much better for people.
So it's
and you really don't think about it all the time.
No.
Even in a work environment, are you in a healthy work environment? And maybe you don't have a lot of control on some levels, but maybe there's some little things you can do to help yourself. You know, stay out of the lunchroom. No, I'm just kidding. you
go talk to the lunch ladies and tell them to get more greens.
Yeah, go for a walk, things like that. But, absolutely. Yeah, so it's hard to know everything, and that's why it's so good to be able to talk with you and talk to other people that have all different types of answers and all different types of solutions, really. So I want to thank you so much for coming. I would love to have you come back and touch on these other things, especially as you develop your healthy habitat idea, because that sounds very good. It sounds very good for people to look at all the different components that create a healthy life.
Yes, yeah, I'm excited. I'd love to. Thank you for having me.
Oh, my pleasure. Thanks so much for coming.
Appreciate it.
Thanks. That was good. You did good. Yeah.
You can tell, yeah.